A very pleasant good day to all of our viewers. Welcome to another Let's Talk. We are delighted that you have chosen to join us this afternoon, wherever you are watching from around the world. Welcome to Let's Talk. Today we have a very special presentation. We are talking about glaucoma, and that is an area that I'm sure you have interest in if you are not viewing and you're listening on Second Advent Radio. We welcome you just the same. We want to begin with a word of prayer at this time. Almighty Father and our God, be with us as we go into this presentation. Grant us your wisdom, be with our guests, help that technology will work well, and that the information presented will prove meaningful to those who view. In Jesus' name, amen. So this afternoon, we have a special guest with us. It is my privilege to introduce someone I met recently, someone who actually attended to me sometime last year when I had an issue with my eye. And my testimony is that she did an excellent job. So she comes highly recommended from me. We have with us this afternoon Dr. Quintero. She is she is a graduate of the Medical University Romulo Cargelos. She has an emphasis, a specialization in ophthalmology in the from the military hospital of Caracas. She finished there in 2013, got a fellowship in anterior segment surgery in the military hospital of Caracas in 2014, then also in glaucoma in Caracas in 2015. From 2021 to 2022, she did special studies in surgical leadership program and got recognition of excellence from Harvard Medical School in Boston, United States. She also did a surgical and medical glaucoma subspecialist from the Queen's University, Kingston, and also a glaucoma specialist. We are delighted to have with us this afternoon Dr. Quintero. Dr. Quintero, good afternoon and welcome to Let's Talk.
Good afternoon. Thank you for that kind introduction. I am super happy. Yes, you was my patient, and like all my patients, I really love to help them. It's a pleasure for me to be here today.
It's a pleasure having you. So we want to talk today about glaucoma, and from the introduction, it's obvious that you have done a lot of work in that area. So can you begin by saying what exactly is glaucoma and why is it important that we give attention to it?
I am super happy because this year I have 10 years working exclusive in this disease, Glaucoma is a chronic disease. Unfortunately, it's a silent disease that can usually affect people over 40 years old. And the prevalence is depend about males or over one, but we have in general. And it's a chronic disease can affect silence in the eye and it's increase the pressure in the eye, okay? 70% of the glaucomas really affect the pressure in the eye without notice the patients. And when we have that, the patients start to lose peripheral vision without notice. And that is the problem with this disease because it's a silent disease. You can lose your vision without notice if you continue with that pressure high for long periods of time.
Okay, so that's very interesting that you're saying. Just for emphasis, you're saying that an individual can have this disease and be totally unaware that he or she has the disease while the disease is affecting them?
Yes, it's totally silent disease until get an advanced stage. That is the reason it's so important, the prevention. It's so important you go and check your eyes because it's the only way we can really have to prevent this disease.
Okay, wonderful. How common is glaucoma in the world, and how does the occurrence in Antigua or let's say in the Caribbean compare to the rest of the world?
Demi, I will try to show you a slide, okay? I will show you a slide right now for we can be clear about how this disease affect the eye. Can I share a screen with you?
Sure, sure.
Yes, okay. I will share this, okay? And I want to show you few slices only. I want to be clear here because I think this is a great opportunity for all the audience can understand what is really glaucoma. I want you to understand two things about this disease. Is the pressure in the eye, is the optical nerve, that is the connection you have with the brain. Thinking this like a cable. You need the cable to connect with your brain. If your cable is broken or is damaged for any reason, you don't will be able to see. I mean, the pressure in the eye, we measure the pressure here, the pressure is produced here, and you have a draining system, okay? And that draining system is what we really need to take care. Because if your draining system is healthy, we have chance that the pressure keep control all the time and your optical nerve doesn't have any pressures. And I will tell you why it's so important because the question he was asking me was about how we can really can diagnostic this disease. And the only way you can know you have this is you go to the doctor. And the doctor need to do some testing for you. And I will tell you this simple. Green, everything is okay. Yellow is borderline. Red, you have some problems. If your testing look healthy, look really colors, beautiful, you have your vision perfect. More change at the back of the eye, more glaucoma you have. And the problem with the glaucoma, that is what we are talking, is this a silence because the only way we can see symptoms is when you lose more you only have your central vision because all your peripheral vision is gone already. Is that dark vision? And I, for the question you was asking me, I want show you this slide. You don't know you have glaucoma because you need to check your vision. Because when it's a normal vision, you see everything. But when it's advanced, you see like a tunnel, okay? And I want to check you this. The problem is in the draining thing, in the draining system. This is a plumbing problem. I always try to explain this to my patients, and I want to learn, I want to be sure all here in the audience know this. If we have a problem in the draining system, we need to pay attention about the draining system. That is the reason the new treatments is we try to help this draining system with laser treatment and stuff. That is the reason when you're using drops for glaucoma, we try to help him with the fluid. And this is the prevalent. This is the reason it's so important for us. When we're talking about the question about the prevalence, is the reality is a lot of patients suffer vision problems, but the majority of the irreversible vision coming from glaucoma. And if we're talking about the Caribbean, this is us. We're talking about cataract.
Can I interrupt you a little bit? Can you go
Yes,
back
of course.
can you go back to the previous slide just a little
Of
bit?
course.
Yes. So this one says that globally, at least 2.2 billion people have a near or distant vision impairment. And in at least 1 billion, or almost half of these cases, vision impairment could have been prevented or has yet to be addressed. So what we're hearing from this is that it is based on what this is saying, a lot of people are not checking their eyes. A lot of the problems we're having with vision could have been prevented if people were visiting their ophthalmologist. Is that what I'm interpreting from this?
Yes, the correct thing is it's not only the ophthalmologists. We need to check our optometrists and all the healthcare workers. And the reason is because this is so important because we can prevent this when we check our eyes. Okay, when we check our eyes with the optometrist and the ophthalmologist, we can see, for example, if you have cataracts. if you have impediment because you require glasses, and with the glasses, we can improve. If you have macular degeneration or you have glaucoma, but the reality is we need to check our eyes. And the thing is, we need to check our eyes minimum once a year to be sure we don't have any of these conditions. But it's a reality, the prevalence is increasing when our style of life is increasing. When we have more diabetes and more hypertension, we have more problems in the eye too, because the eyes don't work by themselves. We walk with them. I mean, if you have diabetes and it's super high and your sugar is high, we will have problems in the eyes. Okay, and I mean that is so important. We check our eyes once a year minimum.
Okay, so you were talking about the prevalence in the Caribbean. Can you go back now and share on that? Yes.
Yes, this is pretty good, and I will tell you this. The thing here is we need to pay attention about what we really can do for our eyes, you know. And I like this imagine is because we can see most of us, and you see that we require glasses. So I'm tired of reading glasses, or we require glasses to see in our days. I mean, most of the things we can repair with glasses when we have only things with glasses, but when we're getting older, we're getting more problems, you know. And we have the cataracts that in one point we will need to remove. That is like gray hair. In one point you will need to remove from your eyes. But we need to pay attention to things really can make us blind. Okay, and that will come. That is the reason it's so important the glaucoma, because the glaucoma is the #1 cause at the world can make patients blind irreversible. I mean, if you lose your vision for glaucoma, the vision don't come back again. No matter what we do, we cannot bring the vision back. If you are blind for cataract, we can do some surgeries, we can do some treatments, and your vision can come back. But from glaucoma, no, it's irreversible blindness.
Oh, that's interesting.
Yes, yes, and that is the reason I want to be super clear here. Prevention is a key. I love this type of talks because if we work together and we understand it's a silent disease, we can prevent this disease. I tell all my patients have glaucoma. Hey, you can't forget about you use your drops. Hey, maybe you forget sometimes you have glaucoma, but glaucoma never will forget about you. It will be there. And if you ignore the problem, only get bigger. We need to be attacking this. Okay?
So somebody is asking, one of our viewers is asking, what do you consider to be normal pressure? You that first slide that you showed, and you indicated that the glaucoma is as a result of the buildup of pressure in the eye. Somebody's asking what is normal?
And I will show you, I will put this slide for that person can understand this. This is the pain of the patient, the pain of your condition. If you have a healthy eye and you have total peripheral vision, we can tolerate pressures of 21 either, and you will be okay. But your glaucoma is advanced. You require pressures really low, either below 12. Okay, that means it's an individual range. Each patient has something we can tolerate. And I tell my patients, if you have good and healthy eyes, we can tolerate pressures a little higher. But if you have glaucoma and your glaucoma is unstable, we know the only way we can control this disease if we would put the pressure down. I mean, the answer is depend, but I will tell you in healthy eyes, we can tolerate 21. In patients with glaucoma, depend of the stage of your glaucoma, the advanced glaucoma you have, you will require pressures low or below 12. If you have maybe moderate glaucoma, we can tolerate 16, 17, depending on the stage of your glaucoma. Each patient is different. And the only way we can't target, the only way is doing testing. We need to have the testing and be objective and see what is your pressure, what is the target of your pressure.
Okay, wonderful. Now, I want to ask you another question relative to the pressure. And this is a question from one of our viewers. They're asking, what causes the pressure to be high?
Okay, let's go, and I want to answer this and be clear about this. Okay, you burn with a draining system, thinking like a plumbing. I want you thinking this like a sink, okay? And you have a fluid, okay? Your draining system need to be healthy for the fluid can pass. If you have family history with glaucoma, if your mom or your dad had glaucoma and they losing vision for glaucoma, or if you are over 40 years old, or if you smoke weed, or if you are myopic or you have any chronic conditions, your draining system has much more predisposition to have change in that elasticity, okay? And when we have that problem, the filtering is not the same. And when you have that problem, is what we see here. This is the draining system. The fluid pass here perfect. But when you have some blocking here, no matter what I do, your pressure will rise up because the draining system is not working, it's not filtering properly. That is the reason the pressure fluctuate and increase. It's a plumbing. If I want to learn something about, if I want something to think about, is plumbing. We need to wait that the drainage system fluid go better in that drainage system. Okay, that is the reason the pressure increase, because your drainage system is stopped to work. Okay, and we need to find a way how to improve. And if you ask me why that can happen, I will tell you this. Usually that happens because you have family history with this disease. Let's go to talk about the general glaucoma, because we can have different type of glaucoma that coming from for secondary things. But the majority of the people develop this because you have a family history with this disease. And what I want to be sure here, if you have any family history, mom and dad, brother and sister with glaucoma, please check your eyes, because you can have disease, you can have glaucoma without knowing, because it's a silent disease.
Okay, so Doc, I want to ask you, I'm not sure if you will finish.
Yes, of course.
So I want to ask you, therefore, um,
How I stop to share here?
you mentioned if I have a family history, that may contribute to me getting glaucoma. But are there specific things or behavior that contribute outside of my family history? Are there specific things that or specific behavior that contribute to the development of this disease?
Okay, I will tell you something we need to clarify here. If you are over 40 years, we have factor of risk we cannot modify. You're born with a factor of risk. Factor of risk of glaucoma is you are Caribbean, or you are Afro-Caribbean patient, or you are Latin patient. You need to know you have more risk to develop glaucoma than the other patients. Okay, number one, we cannot change the race. It's a reality. We have that. The other thing is we are over 40 years old. If we are over 40 years old, that we need to check our eyes, because you have the chance to develop glaucoma. The other thing here is you have family history. If you have mom and dad, you have glaucoma, you need to check your eyes. The other thing here, if you in your life, you have any trauma around, for example, when you was in the childhood, you have somebody hit your eye, you have chance that can affect. What are the things we can modify? Okay, and I don't want to be pessimistic about this, but reality is doesn't have anything we can do to prevent this disease about a healthy style of life. But we know if we eat better and we do exercise, we help our eyes to be healthy with diabetes, bleeding, and prevent things. But specifically for glaucoma, no. One thing we can know is when the patients drink more than 4 cups of coffee a day can increase the pressure. but that don't mean you will develop glaucoma. Maybe it can fluctuate the pressure. The other thing we know, if you smoke weed or marijuana, is specific to fluctuate the pressure in the eye. And when you have fluctuation of the pressure in the eye, you have more chance to develop glaucoma. And if you develop the glaucoma, maybe it can be more aggressive. But the really only thing we can do for this disease is go to the doctor and do the testing. But it doesn't have anything we can eat or put in our eyes to prevent the glaucoma.
Okay, so that's useful. If I drink more than 4 cups of coffee a day, it can increase the pressure in the eye. If I use marijuana, it can cause a fluctuation, and that increases the possibility of developing the disease. And if I develop it from as a result of that, you're saying that it could become more aggressive.
Yes.
Very well. Now, if I'm diagnosed with glaucoma, how does this change my life? What should I avoid and what should I do? So if I visit your office and when you check, you said, hey, listen, Dr. Greene, I'm sorry to tell you, but you have glaucoma. What will you do as a doctor? What are you going to tell me? How does my life change?
I will tell you, my goal is don't change your life. My goal is we can keep the quality of life. And I always tell my patient when we have new diagnostic, this is a disease, it's a silent disease, and we need to give a voice. And the only way we can give the voice, if you understand you have that disease and you need to be conscious that it's a silence and you need to come. I mean, the only thing will change your life really is you need to understand in your busy life that you will need to come to your appointments, even if you're feeling excellent. Because the goal of the life of this is you feeling great. You don't have any change in your life. You using your treatment and you need to do your normal life. But you need to understand in that normal life without any symptoms, you need to keep coming to the appointments. I think that is the hardest things to the patients. When we have a new patient with this disease doesn't have symptoms and really the vision is 20/20 and feeling great, they need to still to come into the appointments. And I will tell you something like this. I see more gentlemen that missing the appointments and coming in long period of time and losing vision for that than women. Women really coming more frequently to the appointments. I think the hardest things for the patients when they have the first diagnostic is they need to understand, even if you're feeling fantastic, you need to still come into the doctor. I think that is the hardest thing for the patients to understand because it's hard because your vision is good. And the goal is you keep fantastic. You keep doing your normal life without any problem. That is the goal.
So let me say a special word to my brothers out there. Gentlemen, the doctor just said you don't like to visit the office. You need to, generally speaking, it is a truth that men do not like to go to doctor. So this is a special appeal to the gentlemen who are listening right now. Please keep your appointments. Please ensure that you don't skip your appointments. It could make a difference between you being blind or being able to see. Now, Doc, I want you did mention just now that people of African, oh, before I go to the people of African descent, earlier when you had those slides on the screen, I did ask you about visiting the ophthalmologist, and you said not just the ophthalmologist, but the optician, the optometrist. So just for the benefit of somebody who may be listening, can you explain the difference between the optometrist and the ophthalmologist?
I will tell you, we need to work like a team. And I will tell you this because we don't have, no either in Antigua, no in any part of the world. I work in Venezuela. I just came from Canada and I work here in Antigua. And I tell you this, optometrists are part of the great team for prevent this disease, okay? I will tell the difference is about we are medical doctors, okay? I mean, we can prescribe medication. That's one of the things. And the other thing is we can do performance surgeries, okay? But the optometrists are perform in my practice here in Antigua, they really do a great job to diagnose these patients and refer for we can start the treatment, okay? I think the most important here is for the patients understand they need to see an eye doctor, okay? We need to go to the appointments and we need to do the testing because it's the only way objective we can diagnose this disease. Okay, you really need to be sure if you have family history. I will be emphatic here. If you have any mom or dad with glaucoma, or you have anybody, an aunt, blind for glaucoma, you need to see the eye doctor. Go to the screening minimum once a year for we can prevent. And I think this will be my answer. We need to work together for prevent this disease. One person only cannot. We need to work together for do that.
Very clear indeed. Now, so earlier you mentioned that people of African descent and Hispanic, so Latin Americanos and Caribbean, African descent, seem to be more likely to develop the disease, the eye pressure. Are there any reasons for this? Why is it that?
Yeah, look like our drainage system is no so when we getting older, the drainage system get a little more rigid. Okay, the reality is the same way like Caucasic have macular degeneration and we have glaucoma. Okay, and the reality is real severe compared to the Caucasic, how is in our population, okay? It's related how is the difference in the eyes. The pigment in the skin, the same way you have pigment in your skin, you can have that excess of pigment in your drainage system. And thinking like a plumbing, if your drainage system is wide open and it's no pigment there, we'll filter it easy. But at one point, if have a lot of pigment there, we'll get blocked. You understand? To me, have theories about that, but it's a reality. And it's more aggressive, and the blindness, the prevalence of blindness compared to the Caucasic with the Afro-Caribbean patients is the majority in the Afro-Caribbean. We can develop really aggressive glaucoma. Is that true?
Okay, very well. Now, can wrong glasses prescription impact my eye pressure?
The answer is no. No. Okay. The glasses will help you to see. Okay. The glasses only focus the imagine in the macula, the most powerful place of the vision, but the reality is no. Okay. That can develop some problems different than headaches and stuff like that, but not the pressure in the eye. No.
Okay, one of our viewers is again asking about dry eye. What causes dry eyes?
Okay, dry eye, let's go to think about. Okay, dry is the same like other part of your body. Okay, the same way your skin gets more dry when you're getting older. We have that. To me, we have more prevalence of dryness when we have extreme weathers. Okay, winter develop dry eye, summer and heat develop dry eye. When we stay all the time in the sun and coming out and coming in the air condition, put a fan over our eyes, of course, we will develop dry eye, okay? And thinking about this, the same way your skin get dry, your eyes can get dry, okay? And the quality of the dry, okay, the quality of your tears, sorry, decrease with you getting more older, okay? So that is the reason we develop dry eye with the years too. We more older, we can develop dry eye. Glaucoma have a specific thing that when you use medication for glaucoma can increase maybe the symptoms of dry eye, okay? But anybody will develop some symptoms of dry eye. I always tell my patient a thing. Don't wait until you feel your eyes. You're not supposed to feel your eye. You're supposed to feel great. Don't wait until you feel your eyes for you to start to use the moisture drops. The moisture drops is good to prevent the dry and treat the dry eye, okay?
So, so now I'm going back to that question I asked you earlier. If a person is diagnosed with glaucoma, what is the now? So your response was that I should live normal, and your goal is to help me to live a normal life.
Mhm.
But and I think you mentioned that you would probably give me some eye drops. What does that do? What kind of treatment does an ophthalmologist give for glaucoma, and how does it work?
I will say this before, like, let's go to say 10 years ago, okay, or maybe less than that. We say the number one treatment or the gold standard treatment for glaucoma was the eye drops. And I will try to explain this to all the patients. Eye drops is to decrease the fluid in the eye, mean reduce the pressure. Okay, simple. That is what we want with the eye drops. I mean, that was the treatment, but we really don't treat the cause. Okay, I mean, we don't really do something in the draining system. With all the new studies, we know the number one treatment for glaucoma is we try to remove the power from the patients and give something more significant in the long term. Okay? What I try to tell you this, when we have a patient and you are, okay, you have glaucoma, sir, we have two alternatives. One is the laser, that we can put a laser in the drainage system for the fluid can pass better. 70% of the cases, maybe you can be drop free for a period of time because doesn't have a cure, have a treatment, no cure for a period of time, or you have the drop. What is the difference between one and the other? One, if you forget to use your drop one night, you will need to put it at the next day because the other way, the pressure will increase. I mean, you will require using drops every day. And have patients really, we know, I discussed with other Caribbean doctors, and we agree sometimes with the laser is not enough. I mean, it's a combination of treatment. But my first option of treatment is laser because the laser gives independence to the patients in a long period of time. And I combine laser with drops and try to keep the patient as most comfortable possible. But has cases where that is not possible because depending of the stage of your glaucoma, you will require more than drops and laser. And that is the glaucoma surgery. Glaucoma surgery is not to improve vision, is to keep what you have and helping you to control the pressure for you can keep your vision in the long term. And I know this is hard for the patients, but the answer is this. Depend about in what stage of your glaucoma are you. Each patient is different, but I can tell you, if you are early, maybe laser for you will be enough. If you are mild or early glaucoma, laser maybe will be enough. And you only continue with your follow-ups. Maybe if you are moderate glaucoma, you will need to do some laser and drops. And even if you have advanced, sometimes we will need to put the two of them, plus maybe we need to do surgery. I mean, each case is different. But the goal is to try to keep your vision for the long term.
That's interesting. So can you just again highlight the different um stages of glaucoma? When would you say that an individual um has gone from stage one to stage two, or how many stages do we have? And
Okay, let me explain this. That is the reason it's so important to do testing. Audience, the only way we can have, if I do and I see with a small sleep lamp I have at work, I only see it. But if we have testing, we are objective, okay? Then now we have a technology, we can compare, we have a software, and we can compare your testing with the same age like you, and we can see what is your stage of glaucoma, okay? And that is the reason I show you that imagine with the colors, okay? We take a pictures at the back of the eye and we see how many cells you have at the back of the eye. And with that cells at the back of the eye, we can say if your glaucoma is early glaucoma, is a mild, mean you start to have some early mild change for glaucoma. Moderate glaucoma mean you start to lose some vision without notice, but you can still drive, you can still do in your life and that. And now when we pass to advanced glaucoma, that is the patients that I tell the patients, even if you have good vision, your peripheral vision is affected. The only way we really can, before we can do it with only with the visit, but the reality is the new gold standard for a stage the glaucoma and know if a patient is stable or no is doing testing, serial testing to know if you are stable and serial testing to know what is your real stage of the glaucoma. We need testing, pictures of the back of the eye and visual field. That is the testing we need to do.
So when I visit my doctor to get my eyes checked, I'm concerned about whether there is pressure in my eye, whether I am prone or likely to develop glaucoma or not. And you're saying once I pass age 40, that should be something that should become a routine test. But what else do I need to be aware of? My observation is, this is my observation, that once upon a time in the older generation, it appears to me, I don't know if my observations are right or wrong, if they're correct or incorrect, but it appears to me as though many of our grandparents and others were able to live into their 70s and 80s without using eyeglasses, and they were able to read perfectly well. These days, an increasing number of persons are having, like myself, I don't like glasses, but I have to use them. Is there something that is contributing to that apart from age?
No, is the expectation of life. Okay, we'll explain in this. And I know this concept is a little controversial, but it's a reality. We getting more with the era of the internet and everything in a click and everything. Our expectation of life is getting higher. We want better quality. We want the same vision that we have in 20 years when we were 20s. We have that. And if you want that, you need to use glasses because your eyes is getting older. We can talk about a lot of things, and I agree about this, about how we eat and all that. But the reality is the highest your expectation, and that can come for your environment where you work, that can come for the type of job, where education you have. More of that, you will have higher expectations and you want to have better vision. You want that vision 2020 and you want that glasses doesn't have aberration. And that is the reason if my glasses have a little crash, I want to change the glasses. You never see that in the other patients with 80 years old. You see they can have a glasses 3 years and they feel happy. But it's the things you do with your life. Is you in your life only watch TV, and have a normal life, maybe your expectations are okay. And they will tell you, I am happy. I see everything good. I only do gardening. And it's different when you sit in a computer for 8 hours and you need to blink because you have dry eye. It's different. Each patient is different. But I think one of things talking about that, the other thing is a reality. The food is affecting us. How we are eating is affecting us. But I think it's our expectations, and the other thing, super important, is the expectation of life. Really, before people die early and we have less problems. I always tell my patients say, why this has so much problem? What age died your father? Maybe when they are 65. Now a 65 person is a young, full of life, and want to have the same vision than when we're 40. You understand what I mean? The expectations are different. But I think can be the food too, but I think is we are more like we want more that vision, that quality of vision.
Okay, so we agree that Thank you so much for that. I never really thought about that before, but it does make a lot of sense. We agree that uh, glaucoma is a silent disease. So at least in the early stages, one doesn't know that one is getting it. But if a person begins to see what I think they call it floaters or little lights, is that an indication that maybe there is pressure in the eye, or is that related to something else?
No, no. No. Flutters or flashes in the eye is related with the retina. Okay, when you see flutters, is the natural gel of the eye, in the majority, is the natural gel of the eye gets soft, okay, and get detached, and you can see that small flutters. If you see flashes or light can come, that's the reason it's so important when you have new flutters or new flashes, you see right away your eye doctor. And the reason is because that can be a symptom of pulling the retina, and that can make a holes in the eye. And that is an early symptoms that before you develop retinal detachment. I mean, flutters or flashes is not directly with the glaucoma, is related with the retina. That is the reason it's important when you have new flutters or you see new light, okay, or flashes or lightning in your eyes, you need to see the doctor right away. Unfortunately, glaucoma only has symptoms when it's advanced. And the goal of this talk is you don't arrive to advance. See the doctor before that, please. See the doctor before that.
So if I see the doctor at an early stage, the doctor is able to help me to sustain or to prevent the progression of the disease.
Yes, the answer is yes. I will tell you this. I try to tell my patients it's not the same when you develop glaucoma when you are in your 35 because your mom was blind with 50, that when you develop glaucoma when you are 65. Okay, it's different. And one of the reasons for that is because the timing we have in front. A person develop glaucoma super early and the family member have blindness from this disease and you are 30, we are a person in front of maybe with 40 or 50 years of we require good vision. It's harder, you understand? It's a long period of time. But if you develop this disease with 60 or with 55, we are less shorter. The goal here is you have any early, moderate, advanced, no matter what glaucoma you have. We need to keep you stable. And the only way we can know for sure, okay, nothing in the life is 100%. Let's go to say 99% sure, okay? The only way of that is doing serial testing because that way we can see, we count in with a software and we say, okay, you are here today, this is your baseline, and over the years, I check in you and you are stable, you are good, we are in a good job. But the goal is that. The goal is keep you in the stage we found you. That is the goal. Oh, and if you will progress, because it's a progressive disease, okay? It's a progress, it's a reality, it's a progression. You progress it as slowly possible that the last day of your life, you have vision. That is the goal. You keep your vision until the last day of your life. Unfortunately, because it's a hard disease, I don't will lie. I have treated patients for 10 years. We have patients really arrive in a late stage of glaucoma that you cannot do anything. But we need to try to understand if you have a mom or dad losing vision for glaucoma when they're in the 40s or 50s, you really need to come early to do this disease. You need to take this serious. And I always tell my patient more than early diagnostics when they come in. We need to talk this in our family meetings. Talk to your family, talk to your kids. If you losing one eye for glaucoma, please be sure you ensure your kids go to the doctor, go to the doctor. That is the reason it's so important for me talking with the family members.
Okay, so we have about 15 more minutes. We're going to try to
Mhm.
use these as wisely as we can. I'm hearing from you, therefore, that this is a progressive disease, but if you can spot it early, the chances of you keeping or maintaining your vision for a longer time is greater. You
Mhm.
did indicate that one of the interventions that you can use is laser surgery. I wanted to ask you, perhaps I should have back then, but anyway, what are the risks associated with this laser surgery?
Okay, we have different type of laser in glaucoma, okay? But the new laser for, well, it's not new, it's something we use now, like the new treatment, but it's not new, is a selective laser trabeculoplasty. It's a safe procedure, okay? Or the name is SLT. It's a safe procedure, take literally 10 minutes per eye. Really is those don't is not related to check to affecting your vision, and it's a low amount of patients develop some little inflammation. That is the reason if you have inflammation or you don't have inflammation, for protocol with send medication. I think the bad thing about this is what happens if it doesn't work. Okay, 70% of the patients is registered in the research that will work, and 30% doesn't do anything. It's not affecting your vision or anything like that. It doesn't work. You don't answer to the laser. I mean, the laser is not enough for you. You will require another thing. Okay. I mean, I will tell the bad thing about if it's you don't answer, but if you are on inside of the 70% of the patient improve with the laser, good part is maybe you can be in a period of time drop free, number one. And number two, be drop free is not because you want to be drop free only. Is because with the drop free, we can avoid the fluctuation, and that helps us to control the glaucoma more in the long term when we're talking about this type of laser. And the second most important is when we do holes in the eye for the fluid can pass. That laser can increase the pressure a little 30 minutes after. That is the reason I tell my patients you need to wait in the waiting area, and we check to be sure is the fluid passing okay. And the reality is the patients after they do the laser, they feel pretty good that they telling you that's it's finished this. I think we don't call that surgery, we call laser because we don't do in an operating room, we do it in the office, in the same machine, practically in the same machine. When the doctor check you, they be able to do that in another machine, but similar. Okay, it's not a surgery, it's a procedure. Okay.
Okay, that's interesting. Yeah, I'm now feeling that there's a lot of hope for people. But I am joining you in saying the important thing is that we make sure that we get tested, that we visit our doctors and make sure that regularly we check to see what is happening. Now, can a person test 1 year and the pressure is fine and the next year it is real bad? Do you
Yeah,
see?
and one of the reason is glaucoma is slowly but sure. Okay. Uh, that's the reason some patients need to be tested every 9 months, and some patients need to be tested every year. Some testing need to be every 6 months. And that will depend about the factor of risk. I tell my patients, depend how many numbers you have for the lottery, we will need to take care of you more. If you have more factor of risk in the lottery, you have more chance to win. Mean we need to check you closer. If you have less factor of risk, we can extend the visits. But the reality is you have family history, and I have patients either the same eye, but the mom lose the left eye, and the patient coming now affecting the same left eye. It's a reality depend about how many factors of risk you have. But can happen, of course, that the last year you were okay, and this year you have some affections. Yes.
Okay, now that's interesting. There are a few persons who are asking, where's your office? So you must be saying some things that are appealing to some persons. We'll give you an opportunity to share that before we finish this afternoon. But I want to ask another question here. Um, when I go to the doctor, let's say somebody comes to you for the first time. This individual has not gone to check his or her eyes before, but maybe they listened to the program this afternoon and they realize it makes sense to go and visit a doctor. When I visit a doctor, what kinds of questions do I need to ask my doctor when I visit?
Okay. Apart about, you will ask the question to your mom or your dad first. Let's go to see you have that question answered already. I think the first question you need to ask your doctor is how much was your pressure? If your pressure is normal for your eye, okay? And the other thing you need to ask your doctor is, my vision is okay for my age, okay? And number three, I think would say, I have any change at the back of the eye affecting me, like diabetes, hypertension, or glaucoma. Through the eyes, we can see many things, okay? And that is so important. When we check at the back of the eye, we can diagnostic new patients with diabetes that they didn't know they have diabetes. They don't know they have this. Never nobody telling them, because it's the first time and they come into the eye doctor and we can see things at the back of the eye suggesting us you have diabetes or you have uncontrolled blood pressure, okay? I mean, I think that they will be the three things. How is my vision? How is my pressure? And how I look at the back of the eye.
Now, your second, so that question is interesting. Of course, next week we're going to be talking about the effect of diabetes on the eye. So we will hold those kinds of discussions for next week. But um, you just said something that kind of sparked my attention there. Um, you look in my eye and you are able to tell that a few things are wrong. So the eye is kind of like a gateway to.
Is the window for the body. You remember when they say they can see the window of your eye, of your body inside? Yes, the eyes are the window for the body. It's the place where we can see alive vessels, okay, without do any surgery. Through a small lens, we put it in the eye. We can see the back of the eye, and we can diagnose that. And not only that, many things we can see at the back of the eye. But let's go to talk the general things. I think it's important we check once a year the back of the eye, and more if you have family history with chronic disease. And I will tell you something here. If somebody is snoring at night, a lot of patients with big bellies and snoring at night. Okay, snoring at night, and I will be a little general with this, but let's go to see patients suffer with the sleep apnea can be related with glaucoma too, okay, because the perfusion at the back of the eye. That is the reason it's so important. We can keep a healthy style of life. I tell my patients the eye don't walk by themselves. Mean you need to have a healthy body for you have a healthy eyes. You want to have a good vision, you need to have a healthy body, have that healthy eyes. I mean, we need to take care to be sure we are doing proper exercise and taking care of what we eat, because we are the reflect about what we eat every day.
This is amazing. I'm tempted to ask you this question. Maybe drifting a little bit off the topic, but next week we're talking about something else. And since I'm talking to you, let me ask. I have heard people say that the deterioration of your vision is sometimes accelerated by glasses, wearing glasses. I've heard the argument that, listen, if I get a prescription and I use it, let's say when I'm going to use myself as an example, when I first sensed the need to wear spectacles, it was for reading purposes. But I found it very challenging to have to put on my glasses when I want to read something, take it off when I don't want to read it. And so I got what I think is transition, so I don't have to be taking off, taking on, taking off, taking on. And then pretty soon I realize I'm dependent on the glasses all the time. So does the glasses really help? And then you go to the doctor again and they prescribe a stronger prescription and then a stronger one. And so some persons believe if I had just stuck to my first one, maybe my eyes would have been better. What's your view on that?
Yeah, I will tell you this. One day I was in a conference, an optometrist answered something, and I'm sure if any optometrist here will be maybe agree with me. Okay, I will give you this analogy. That is like you see a TV, a old TV, a old one, maybe a little colors, old one, maybe 10 years ago, and that is your eyes, and you put the new glasses and it's like the new TV, full colors, all stuff. You would prefer stay without the glasses, have that quality of life, or you will prefer use the new glasses and see clear. I don't think it's related with the glasses, really. Okay, the reality is related about when we are getting accustomed to have this vision. Okay, we want to keep that vision, and it's a reality of the natural lens of the eye. Happen two things. When after 40 years old, each year, okay, we see more deterioration of the near vision. Each time we are more like this until we decide to use glasses, okay? That is, and it's getting worse until we really require complete glasses. And it's not getting better, okay? It's a reality, but it's the muscle in our eyes. The segundo reality is in the natural lens in the eye start to develop some change, and that is why we say cataract. Not all the cataracts require removal, okay? And that is the reason your prescription of glasses change. But no, is your glasses or your doctor is doing something wrong for you buy more glasses. No, the reality is you want to keep that beautiful vision you had before, and you will change your glasses to try to keep that vision until you one day require cataract surgery. But it's not related with the glasses really. If the prescription is proper done, usually once a year, you will need to change the glasses. More for the near part. The near part is really affected every year.
Okay, very well. Well, let's just summarize what we have shared today. We learned that glaucoma is a silent disease, and which means that you don't really see symptoms or signs, so you have to visit the doctor to get checked. If you don't do that, you run the risk of becoming blind, because when you begin to feel signs and symptoms, you are it's already at an advanced stage. Am I doing well so far?
Yes, you're doing great.
Wonderful. We also said that generally speaking, you can live your normal life, but one needs to be mindful that there are a few things that may impact the glaucoma, or not the glaucoma, but the pressure in the eye, and hence related to glaucoma. So if you drink more than 4 cups of coffee a day, it can increase the pressure in the eye. If you use marijuana, it can fluctuate the pressure in the eye, which makes it more likely for you to develop glaucoma. And when you do get the glaucoma, it can accelerate at a faster, so progress at a faster rate. So that's information that our viewers want to take into consideration. But the overriding factor here, what we want people to leave with today, is that it is important that they get regular checks with their doctors.
Yes.
Anything else you want to add in summary?
Summary, please talk. Talk to your family members. If you have a family if you have the glaucoma, tell your kids. And if you are the son of, and your mom use glaucoma drops or any kind of drop, ask your mom. Talk to your family members. They can give a lot of information for us that is value for treat diseases.
Now, there are a few folks who want to know where they can find your office. So can you share that information?
Yes, I work in Stepa Clinic in front of the Catholic school, the boy of Catholic school. We are there, and will be a pleasure to see you guys. Yes.
So that is Stapleton Lane. Many of you who are from Antigua would know where St. Joseph's Academy is, or where the Walwins, I believe it's Dr. Walwin's office is. So that's your location. All right, wonderful. Well, Dr. Quintero, it was a pleasure talking with you this afternoon. Next week, you are going to be back with us, I understand, and you're going to be talking about the effects of diabetes on the eye. That is going to be an interesting discussion. So I'm looking forward to seeing you then. Again, thanks for the information. You have shared some perspectives that I have never thought about before. And I will make sure, we want all the men, especially men. One of the things the doctor said this afternoon is that there is a tendency for men not to keep their appointments. So please, that's an appeal to you. Keep your appointments. You don't want to get old and blind. That is not a good thing. All right. So thank you so much, Doc. It was a pleasure. And may God be with all of you. Next week, again, Dr. Quintero is going to be with us. Again, we're going to be talking about the effects of diabetes on the eye. Remember, she said this afternoon, they can look in your eye and tell whether you have diabetes, whether you have high blood pressure, etc. We will get into that kind of stuff next week. And the week after next week, Dr. Bell Jarvis is going to be back with us. Remember last week, while we were talking about that first 1,000 days of a child's life, we really only did scratch the surface. And so she's going to be back with us after, that's 2 weeks from now, where we continue that very important discussion. May God bless you until next week.